So, endocrine disorders. I want to show you a couple of websites that you might find interesting that this chapter talks about. This chapter talks about endocrine disrupting chemicals in our environment. Endocrine disrupting chemicals. Those are any chemicals that can mess with your hormones. The word endocrine is simply talking about our hormones. And examples of hormones are like your thyroid hormones, your sex hormones like testosterone, progesterone. We have a bit of a crisis worldwide with endocrine disrupting chemicals. These are chemicals found in the environment that jack up the human endocrine system. So much so that we're tracking various things worldwide, such as birth rates, how many babies people are having. And those birth rates in every country in the world, for the most part, are going down. And the reason we think is because of endocrine disrupting chemicals in the environment. So one of the websites I want to show you, and I'll put these links in an announcement later. I'll try to upload this lecture video and put these links if you're interested. The Centers for Disease Control, CDC, this specifically tracks hormone disorders. And they have a nice website about hormone disorders. It says here that hormones are chemical messengers that are secreted by glands in your body and regulate many functions as part of the endocrine system. The hormone disorders occur when a gland produces too much or not enough of a hormone. Hormone disorders can be caused by many things, including being exposed to certain chemicals in the environment. So the CDC is tracking. They are tracking stuff. They're tracking hormone levels in the entire population. But they're also trying to track the amount of certain chemicals that we know for a fact mess with the human endocrine system. Pesticides, industrial chemicals, probably the scariest type of chemical, though, just because it's everywhere, is plastic. Plastic. All the different types of plastics, and there's thousands of types, mess with the human endocrine system. We're tracking the thyroid hormone function. As an example, thyroid hormone levels include T4, which is called thyroxine. My computer's not working. T4 and also T3. And then also thyroid stimulating hormone. So we're tracking those three thyroid hormones. And then here's links to a bunch of different websites. The National Institute of Health has a whole website too devoted to endocrine disruptors. Plastic bottles and containers. And so how many times do we drink our water right out of a plastic bottle? And so most of your bottles will say I'm looking at your water bottle here in class. Does it say BPA free? Yeah. So he has a kind of a shaker bottle with water in it. And there's a sticker right on it that says BPA free, which I think is great. We've realized that BPA messes with your hormones. The downside, though, to that sticker is a false sense of security because it's still a plastic bottle. And there's probably 1,000 other types of plastic that also affect the human endocrine system, and we don't even know. The problem is there's so many chemicals, we don't have very much research. We do have good research on BPA, and that's why we banned it. But what other chemicals are in that bottle? I don't know. We don't know. The level of plastic in your bloodstream is partly dependent on whether you are male or female. In the United States, 100% of females have detectable levels of plastic. We actually would have you pee in a cup and check your urine for plastic. Females have a higher amount of plastic in their body. And the reason we think that is cosmetics. Females tend to use more cosmetics, and that's listed on here as a very common source of chemicals, especially plastics, that mess with the endocrine system. American men, about 80% of us males have detectable levels of plastic. Another source of plastic in the environment, and when I say plastic, there's a weird word that I can't pronounce. Can't even spell it, apparently. Phthalates. I'm assuming the pH is silent. Phthalates. Phthalates are used in cosmetics and lots of other consumer products. So the problem with phthalates is that they do seem to be endocrine disruptors. They are used as a plasticizer in products such as nail polish to prevent your nail polish from cracking, hairspray to help avoid stiffness, and then a solvent in fragrances. So perfumes, Axe body spray, Axe body wash for men has all of these phthalates in it. So those are called endocrine disruptors. And we are starting to pay more attention to those things, which I think is good. One of the things I've noticed just in the last 2 years, when I take students to the hospital for clinicals, all of our psych meds now have a red sticker on them. When we administer psychiatric medication, we have to use special handling. OSHA says if you're opening a Depakote pill or a Topamax pill or a Risperdal pill, all of these psych meds have a big old red sticker on them, and we have to double glove, wear PPE, dispose of the packaging in special chemotherapy waste bins. The reason for that is all of those psych meds are considered endocrine disruptors. And so the OSHA, the Occupational Safety Administration, says that nurses and medication aides are jacking up their endocrine system by opening pills. And those pills are endocrine disruptors. The World Health Organization also has a whole website devoted to environmental health, but endocrine disrupting chemicals. And this website was a publication from 2013. If you're interested, you could read that full report. This can be pretty overwhelming, I think. For me, I try to eliminate endocrine disruptors from my life. So one thing that I have been doing myself personally is I try to read the labels for like shampoo. I don't use much shampoo because I'm mostly bald, but I've stopped buying Axe body wash. I can tell you that, because if you read the label to your shampoo, your cosmetics, if there's words on the back of that label that you cannot understand, they're long chemical names, I would encourage you to pitch it.
There's a lot of like shampoo companies and stuff that are under lawsuit right now.
A lot of lawsuits, class action lawsuits against shampoo companies, she said. And that's why it's messing with your endocrine system. Another website that I pulled up here. Oh, we'll talk about some of those other websites, but so endocrine disrupting chemicals in the environment. The biggest, probably the biggest source of plastic in the air, many cities measure the amount of plastic that is airborne. And London is a city that measures the plastic and chemicals that are airborne in the city. And they measure it in tons. Tons. How many tons of rubber and plastic just sort of fall to the ground in the city of London each year? Those are endocrine disruptors, and we think the primary source of that dirty air, which is dirty with these endocrine disruptors, is car tires. Car tires. So if you think about how your car tire wears down over time, the thread, where's that going? It's actually being aerosolized into the air. And so we do breathe a certain amount of plastic. But primarily we think the plastic that you're peeing out is coming from your cosmetics. Coming from your cosmetics. So do think about that. Other endocrine disruptors that you might notice in your home is anytime you smell a new carpet smell or a new couch. Have you ever got new furniture or a new carpet and it's a very strong chemical odor? And at the time, like for me in the past, I've enjoyed that smell because it meant, yes, got new furniture. This is awesome. Or finally got new carpet. Carpet and furniture off gas, it's called off gassing. They're emitting volatile organic chemicals into the air. That's what you're smelling. That new car smell is the plastics and the chemicals off gassing. And it can take years sometimes. The biggest source of the chemical that is an endocrine disruptor with new furniture is the flame retardant. They have to spray new furniture with a flame retardant chemical. That way, if you're smoking on your couch and you drop your cigarette, it won't just poof, catch on fire, flame retardant chemicals, but they off gas, they are endocrine disruptors. Any questions about endocrine disruptors? Messing with your endocrine system. Here's some common list of common ones. This is on the National Institute of Health, BPA. But then there's over 10,000 chemicals that are known endocrine disruptors that we produce because we are a consumer society. We consume stuff. This is that flame retardant chemical called polybrominated diphenyl esters. Phytoestrogens are actually, this phytoestrogens, they have hormone-like activity, and this is the reason I don't eat or drink anything with soy in it. Soy products are kind of notorious for disrupting your endocrine system. I don't know what's going to come of this pandemic and all of this darn hand sanitizer we're using. I don't know what's in this. This is a made in Lincoln hand sanitizer product. Has anybody used it? Man, if you smell this stuff, it smells toxic. It's like, oh, it smells like fingernail polish remover. Here I am rubbing it on my hand. An important thing to know about your skin is your skin is your second mouth. Your skin is your second mouth. So if you wouldn't eat it, you probably shouldn't put it on your skin because your skin just absorbs it. And some of this, I don't know how much of this is absorbed systemically, but we've had case reports of people dying since this pandemic because the manufacturer of the alcohol hand wash got the wrong amount of or wrong type of alcohol. And there was some cheap products that had methanol in it, different types of alcohols that were absorbed, and then people's livers were shutting down because with disinfectant, us nurses were pretty notorious for thinking if a little bit is good, a lot is even better. And so people were dousing themselves in this stuff. Your skin is your second mouth. Also, don't drink bleach. That's another bad idea. People have died since this pandemic. I think Trump actually tweeted that at one time. Don't drink bleach. I could tell you some stories of people who drank bleach. Well, I'll tell you one story of a man, young kid, 19-year-old. He was drinking bleach, and I had him as a patient in the ER, and he was drinking bleach, and so I assumed that he was suicidal. I said, "So why are you wanting to kill yourself?" I said, and he said, "What? I'm not trying to kill myself. That's crazy. I've got a lot to live for. Why would I want to try to kill myself?" "Well, why were you drinking bleach?" And he said, oh, I was drinking bleach because I had applied for a job at McDonald's and they said they were going to drug screen me. I had to pee in a cup for my McDonald's job. And he had read online that bleach will clean up your drug screen. And so he had just been drinking right out of the gallon. And the problem with bleach, that kid, 19-year-old, he did okay. But I had a different patient sometime before that who ended up dying from drinking bleach. And the problem is it starts kind of eating you from the inside out. And it doesn't do it fast. It took this man that I'm thinking of about 4 or 5 days before the bleach finally ate through important vital organs. Anyway, I called the Poison Control Center. That's what we do whenever somebody has ingested a toxic substance and we don't know what to do for them. We call the Poison Control Center. So as a nurse, you might get to do that a few times. I've done it a lot. 1-800-222-1222. Probably did that every shift for 10 years, called Poison Control. And I asked the Poison Control lady, can bleach actually clean up your drug screen? Because that's what he read on the internet. And she said, oh, absolutely. It works great for that. It'll clean your drug screen out. She said, the only problem is you're not supposed to drink the bleach. You're supposed to dip your finger in the bleach and then pee on your finger. That's how much bleach you need. Just tiny little bit of bleach in the pee specimen cup. And she said it does seem to clear out some of the drugs on the drug screen, but don't drink bleach. It will kill you, and it's a slow, agonizing death. It can definitely be overwhelming, so don't obsess about it too much. I've had some biohacking buddies that went over the top and trying to get away from endocrine disruptors, but one endocrine disruptor that you might not think about that people use all the time are essential oils. Essential oils. Essential oils are marketed as a cure for everything. And I think the reason that they're so popular is because they actually do work. They do stuff. They do stuff. The problem is we don't know what it is they're doing. But the CDC released a report in like 2016. They had a couple case studies of little babies, little baby boys who started growing boobs and lactating. They developed breast tissue and started producing breast milk. And the culprit were the essential oils that the moms were spreading all over the baby's skin. Remember that your skin is your second mouth. And a couple of the, trying to remember which ones were implicated. I think eucalyptus was one, maybe. So those essential oils are, some of them are endocrine disruptors. Something to think about. So what are the endocrine glands? Well, they secrete chemical messengers. A hormone is a chemical that goes somewhere in your body and does something. A hormone goes somewhere and does something. We call chemicals a hormone if we know a lot about it. If we know where it's secreted from, and we know where it goes, and then we have a pretty good idea of what it does, we will call it a hormone. We only have in this chapter a couple dozen hormones in the human body. The reason for that is we don't have the research to know what all the other chemicals are actually doing. The liver, for example, is an endocrine organ that secretes like 10,000 different chemicals. But we only know where they go and what they do for a couple of them. And so there's tons of chemicals in your body, but the ones that we've really thoroughly studied, we give them a name and we call them hormones. Many endocrine processes involve several tissues. The hypothalamus is part of your brain. That's part of your brain. And then your brain, your hypothalamus, sends a signal to the pituitary gland, which then secretes a hormone. The pituitary gland is divided into two parts. The anterior pituitary receives a hormone signal from the brain, and the posterior pituitary is slightly different because it's actually made up of neurons or brain cells. So this gland, the pituitary gland, half of it is actually brain tissue. The posterior pituitary releases hormones, but it's slightly different in that it's actually brain tissue or neurons. So after the pituitary secretes these hormones, those hormones go someplace. And the place they go are end organs. We call those end organs. The end organs are the targets for the pituitary hormones, and those end organs might do something. They may or may not secrete additional hormones, but some of them do, like the adrenal glands. The adrenal glands then secrete more hormones. So we have the hypothalamus, pituitary, and the end organ. And we call that an axis. So we have the HPA axis, which is hypothalamic, pituitary, adrenal axis. That's just one example. We have the HPT, hypothalamic, pituitary, thyroid axis. We have the HPG, hypothalamic, pituitary, gonads. The HPA, hypothalamic, pituitary, adrenal, is what I talk about constantly in my mental health class, because for many years, probably 3 decades or so, we've described all the mental health problems people develop as a problem with the HPA, the hypothalamic pituitary adrenal axis. So the pituitary is broken into the anterior and the posterior. The anterior pituitary is, it communicates through the blood stream or the blood vessels. The hypothalamus communicates with the anterior pituitary through blood vessels. The hypothalamus communicates with the posterior through a neural connection, so actual nerves. Hormones that are made by the hypothalamus are stored and released by the posterior pituitary, and also hormones are released from the anterior pituitary. And there's a list here of the different hormones that are secreted from each half. We have growth hormone from the anterior pituitary, prolactin, adrenocorticotropic hormone. That's the one that travels down to the adrenal glands. Thyroid stimulating hormone, that travels down to the thyroid. Follicle stimulating hormone and luteinizing hormone travels down to the ovaries and testes. Prolactin, growth hormone, all of these hormones have very important roles and do important things. I was talking about the essential oils that cause little baby boys to lactate and start secreting breast milk. That would be hitting on that prolactin, which just so happens to be the same chemical that a lot of our psych meds, like Risperdal effects. Our psych meds are endocrine disruptors. And you might have seen TV commercials for Risperdal. They have a class action lawsuit. They're getting sued like crazy. It's pretty embarrassing if you're a 13-year-old boy in middle school and you're staining the front of your t-shirt with breast milk. And that's what happened with Risperdal, which is an antipsychotic medication. Your posterior pituitary gland secretes antidiuretic hormone and oxytocin. Oxytocin is a hormone that seems to be pretty important for human connection and bonding and love. We know that we know that moms love their babies and babies love their mommies, and that all seems to be modulated by oxytocin. Oxytocin. Antidiuretic hormone. Does anyone know what a diuretic is? Yep, a diuretic gets water off the body. It makes you pee. A diuretic makes you pee. And an antidiuretic is the no pee hormone. No pee hormone. The endocrine system is regulated by a negative feedback loop. A negative feedback loop. The end product hormone negatively feeds back to prevent further stimulation. An example would be your thyroid hormones suppress the thyroid stimulating hormone production. So the thyroid hormones are T3 and T4. And as those levels climb in your bloodstream, they tell your thyroid to stop kicking out, or your pituitary gland to stop kicking out TSH. So it's a feedback loop. Two words to describe the receptor activity of the endocrine system are upregulation and downregulation. Upregulation means an increased receptor sensitivity and number. Downregulation, decreased. So we talked last week about insulin receptors, I think, or maybe the week before. That'd be a classic example of downregulation. Decreased receptor sensitivity. If you eat a ton of sugar every single day for years and years, your insulin receptors downregulate. They downregulate. We see upregulation and downregulation with all kinds of drugs. All kinds of drugs. Definitely with drugs of abuse, like methamphetamine, cocaine. Cocaine and meth, they downregulate everything. They're really what we call sympathomimetics, which means they mimic the sympathetic nervous system. It's like cocaine. It just mimics what the adrenal glands, which are an endocrine organ, it mimics what your adrenal glands do. So if you're taking meth or cocaine regularly, you are teaching your adrenal glands to stop kicking out hormone. Some other examples are, for men, there's a company here in town that is called Ageless Male. Ageless Male. I got an email from them just a couple weeks ago. They're hiring a nurse. They need a nurse at Ageless Male. One complaint that I have about Ageless Male You might have heard their radio commercials. Is they're a big fan of testosterone replacement therapy. So things like a testosterone patch, which we know that hypogonadism is a huge problem worldwide, which is low testosterone levels in men, which is partly contributing to low birth rates. That low testosterone probably caused by endocrine disrupting chemicals in the environment, the high amount of plastic in the environment. So it would make sense if you have a low testosterone level, wouldn't you want to replace the testosterone? Well, as it turns out, replacing testosterone almost immediately tells your body to never ever produce it again through a process of downregulation. Never ever produce that hormone again. So the problem with testosterone replacement therapy is if you start it, you have to be on it the rest of your life. An example of downregulation. We see this happen even with medications as benign as Tylenol. A huge source of headaches for people are actually the rebound effects of Tylenol. Like if you get regular headaches and you're taking Tylenol all the time, pretty soon everything downregulates. And as soon as you try to go a couple of days without that Tylenol, you get a rebound headache. The leading cause of headaches in the hospital is due to this phenomenon and the chemical caffeine. Something like 80% of the world population is addicted to caffeine, and the number one cause of headaches in the hospital is caffeine withdrawal. Because if you go in and have surgery, your MPO can't eat or drink from midnight the night before, and then after surgery that afternoon you still haven't had any caffeine, now you have a rebound headache. And that's due to the downregulation that the caffeine causes. The other thing that caffeine does, if I go back one slide, caffeine itself is a diuretic. And it works by axing or eliminating antidiuretic hormone. Caffeine suppresses that hormone. So then you go for 12 hours or 24 hours with no caffeine, and you get this pounding headache, rebound headache due to the downregulation and also that ADH effects of caffeine. This is an example of that feedback loop. The hypothalamus tells the pituitary gland to secrete the hormones which travel down to the endocrine gland. That endocrine gland might be the adrenals. And then the endocrine gland, the adrenal gland, or the thyroid gland secretes hormones, which then tells the hypothalamus and the pituitary, hey, we've got enough of this hormone. You can chill out. It's that feedback loop. Three major types of problems that we can see. We've got hormone deficiency, hormone excess, and hormone resistance. Probably the best example of hormone resistance is in the next chapter, which is the diabetes chapter, insulin resistance. We can have hypofunction. Hypo just means low. Hypo means low. Low function. Hyper means high. We can have primary, secondary, or tertiary. The way that I memorize these terms, this primary, secondary, and tertiary will come back and haunt you in exams for the rest of your nursing career. What is primary, secondary, and tertiary? The way I remember this for the endocrine system, primary is the gland itself. The gland is having a problem. Maybe it's your thyroid gland having a problem. Maybe it's your adrenal gland having a problem. Secondary just means your pituitary, which is your master gland, having a problem. Tertiary is one step up from that. Your brain is having a problem. So your primary is your organ down in your body somewhere. Secondary is your pituitary gland. Tertiary, your brain, the hypothalamus. We also have different causes like autoimmune. Probably the most common thyroid problem is Hashimoto's thyroiditis. That's an autoimmune. Hashimoto's is an autoimmune, means your own immune system has attacked your thyroid. Type 1 diabetes. Type 1 is autoimmune. That's when your own immune system attacks your pancreas. Neoplasia, just a fancy word for cancer. Cancer. Well, that makes sense. You get cancer of an organ, you're going to have problems. Another interesting thing about cancer is quite often that cancer tumor, starts secreting hormone substances. A classic example is lung cancer. Start secreting ADH, which is antidiuretic hormone. That tumor itself can start secreting hormones. And then we talked about endocrine disrupting compounds, which are chemicals in the environment that can alter endogenous hormone functions. Endogenous means your own body. That's all that means, is your own human body. I just love the endocrine system content. How much of this do you really need to know? I would say this chapter, just plan on spending the rest of your life studying this chapter, endocrine chapter. The next chapter, the diabetes chapter, try to master that while you're in nursing school. You will save lives with the diabetes. But with the endocrine chapter, man, we had on Monday and Tuesday, I was at critical care clinicals with my student, and we had a patient with Addison's disease. And this chapter talks about Addison's. I haven't taken care of Addison's for probably 15 years. It's probably been 15 years since I've had a true adrenal crisis. Addison's is a disease of the adrenal gland. I'm just going to tell you this story about clinicals, and then we'll take a break. Addison's is a disease of the adrenal gland. The adrenals sit on top of your kidneys. Probably the most famous person in history who had Addison's was John F. Kennedy, JFK. He was the president, he was assassinated. He was also a good-looking dude. He was good looking, and he always looked like he had a nice tan. Looked like he had a nice tan. That's a symptom of Addison's. It affects the melanin production in your skin. And so when we were pre-assessing for clinical Sunday afternoon, I made assignments. I was hitting the books because I have to look Addison's up every single time. I have to research it to remember what it is and remember how to take care of this patient. So when you're reading this chapter, keep that in mind. You probably won't totally memorize all these things, and then you won't even see this patient for 5 or 10 years. But the weird thing is, I spent Sunday looking up this one patient with an adrenal crisis, and then Tuesday, we had 2 more patients. So we had a total of 3 patients in an adrenal crisis in 1 week of clinicals. Pretty exciting. The other thing about an adrenal crisis is we treat them exactly opposite of what you think. So each of those patients came to the ER with a catastrophically low blood pressure. And the one girl, she was 37 years old, young, 37. Her blood pressure was 50/20. 50/20. That's such a low blood pressure that you probably can't feel a pulse. If you're trying to palpate a pulse, you're like, man, I don't even know if she has a pulse. Should we start CPR? I'm not sure. So when you have that patient with a really low blood pressure, your first thought, I got to run and get the Levophed. I got to get some Levophed, start an IV Levophed to bring that blood pressure up. Levophed is a potent vasopressor. Bring that blood pressure up. But she didn't need Levophed. What she needed were IV steroids. Steroids. Because steroids are what your adrenal glands secrete. Yes. So somebody with Addison's has to be on those steroids every single day for the rest of their life. And when you get sick, the oral steroid that you're taking at home often isn't enough. And that's what leads to an adrenal crisis. So to treat that really catastrophically low blood pressure, we run in the room and we squirt in some Solu-Cortef or Solu-Medrol, different types of steroids. And almost instantly, her blood pressure got better. And that was another life saved by a nurse who looked up adrenal crisis because she hadn't. I actually talked to the nurse and she's like, yeah, I haven't seen adrenal crisis for 10 years. I had to look it up, see what it even was.